And you are giving your children clinically proven to be safe for kids.
Doctors warn that all too often pharmaceutical companies are leaving children out of the studies.
Well, now this is leading to questions from parents using an extremely common medicine.
7 Action News reporter Kim Russell with the story of parents who fear MiraLAX gave their children psychiatric problems.
About 1 in 5 children will see a doctor for constipation. It's an extremely common problem, and oftentimes doctors will recommend that children take MiraLAX. But now, many parents are going online, voicing concerns that beg the question, is it safe? Emily Deweerd's daughter Coley struggled with constipation starting as a baby. Her mom took her to multiple doctors. Finally, one recommended MiraLAX.
I was like, this is the answer I've been waiting for. It's something that I can just give and it will help.
It worked. She relied on the medicine. Then when Coley was about 3.5 years old, her parents noticed she started having aggressive and obsessive behaviors.
There was a lot of hand smelling like this about 50 times to 100 times a day.
Emily and her husband saw a post online about parents wanting to know if MiraLAX caused their children's behavioral problems.
And I just looked at him and I said, oh my gosh, all of this stuff that is happening to her might be from the MiraLAX because it just came one day.
They started trying other products and took Coley off MiraLAX.
2 days, about 2 days it took. I noticed that the hand smelling was almost completely gone.
So did MiraLAX cause her daughter's behavioral problems?
What I could say in general is that it's fascinating because the gut chemistry and the brain chemistry and biology are strikingly similar.
Dr. David Rosenberg is chair of psychiatry at Wayne State University and Children's Hospital of Michigan. He is not Coley's doctor, but says in general, often children with digestive issues also have psychiatric issues. Some of the neurotransmitters in the body that regulate your gut also regulate your brain.
Severe constipation and the underlying causes of severe constipation have robust associations with psychiatric and behavioral disturbances such as obsessive compulsive behaviors, disruptive behaviors, attention deficit, tremor, and tics.
He says it is hard for doctors to determine whether an underlying issue or MiraLAX caused such behavioral problems because while it's often recommended for children, MiraLAX is not FDA approved for children. There simply has not been enough clinical testing done to determine possible side effects in children. It's a problem doctors see with drug after drug. Testing all too often stops after a drug for problems children suffer from too is approved for adults.
Children, I believe, are the diagnostic and therapeutic orphans of American healthcare. And they get short shrift in this system, and hence you have concerns like this.
An FDA study has been started that could bring answers as to how MiraLAX impacts children. But there are many more drugs being used for years for children without FDA approval. It puts pediatricians in a tough spot. How often are you seeing this, that there are drugs that are tested on adults but not on children that really are needed for children?
Every day.
On the Parents Against MiraLAX Facebook page, parents shared similar stories to Coley's. Emily Deweerd says her daughter now takes other medicines for constipation and is doing well.
We could almost just watch her change back to the normal child that she is.
Bayer, the company that makes MiraLAX, says that it has a long history of being safe when used as directed on the label. And it says there are studies that show it is safe in children as well. It's working with the FDA to look into any concerns. Kim Russell, 7 Action News.
Well, at least I'm glad their little girl is fine. Now you got to be so careful what you give your children, you know?
Yeah, the word is you always consult your doctor. In a case like this, though, do your research. I mean, the internet is full of information. Just be careful. There's a lot of bad information out there, too. So do your homework and find out what's really happening with it. Look for those pages like that. At least you have some questions you can ask.
For sure, for sure.